Welcome to Front Range Focus. I'm Robin Hart. Recently, Bloomberg reported on a recent study that was published in the Journal of Oncology. The study concluded that married patients live longer, receive better treatment, and were more likely to be diagnosed before the cancer spread. Married patients who have cancer do better than unmarried patients, particularly married men. Welcome surgeon and cancer specialist Dr. Peter Edelstein to weigh in.
Well, this is really a very interesting study because as a surgeon who's taken care of cancer patients for many years, myself and my colleagues, we've always suspected that some of this was true, that there were some advantages that married cancer patients had relative to unmarried cancer patients. And here we have a study that really tries to objectively define that. And the first thing that we are trained to do when we look at a study like this is say, well, who did the study? Is this a credible group of people or not? And first of all, this is a highly credible group of researchers. You're talking about physicians from Harvard, Dana-Farber, MD Anderson, UCLA, so top-tier cancer institutions. So first thing you say is, wow, this is a credible group of people who did this study. The next thing you say is, how many people did they look at? Did they look at 10 married people versus 10 unmarried? Well, the answer is they looked at just under 735,000 patients over a 4-year period, and they looked at all of the cancer patients who had any of the top 10 most common cancers. So now we say, okay, good researchers, a good group of patients to study. And finally what they did is they did what physicians and researchers call an adjustment. So they adjusted their study to take into account patient age, race, education, income, cancer stage, cancer treatment. And really in a nutshell what that means is they were comparing apples to apples. I mean, reasonable comparisons. Or maybe we'd say they're comparing married apples to unmarried apples. So when we look at this study and say, wow, good study, what did you find? The first thing that jumps out and is really quite dramatic is that married cancer patients were 20% less likely to die of their cancer than single patients. That's a huge, huge benefit, a 20% survival advantage. So right off the bat, you go, well, that is amazing. Well, what explains that? If you get into the details of the study, anyone can understand what leads to that great outcome. First of all, if you are unmarried with cancer, you have a 53% less likely chance that you're going to receive adequate and complete treatment. And we can talk about the reasons for that, but right off the bat, 53% less likely you're going to get what your doctors recommend from start to finish in terms of treatment. Another factor is that unmarried cancer patients present to the doctors later. That is, at the time that they first get their cancer diagnosis, unmarried cancer patients are 17% more likely to have a cancer that's spread, or the medical term is metastasized. So here you have unmarried cancer patients who present with more advanced disease, harder to cure, and even when we adjust for that versus married cancer patients with spread disease, unmarried patients are 53% less likely to get the complete treatment they need. And what's the outcome of this? If you're married, you have a 20% greater chance of surviving and not dying from your cancer. Very, very impressive results.
So being married, being more successful after a cancer diagnosis, is it because your spouse is connected to you, loving, they can help you, they can support you through this, help you through the cancer diagnosis?
Well, you're asking a great question, Robin. What is it that would lead to this? And I think you've hit it on the head. There are a lot of factors. First of all, if we just get into what is a spouse, you know, in many relationships, other than you knowing yourself, no one knows you as well as your spouse. No one's invested in you as much, loves you, may have raised a family with you. You face challenges and successes together. This is your partner. And that person really is in the best position to be your eyes and ears. So when I share with patients that they have a cancer diagnosis, the strongest, most rational, most educated patient is just as overwhelmed as any other patient. It's an overwhelming thing to hear. Those three little words, you have cancer, send you into a tailspin. And now you have to process all of this complex information and recommendations and time schedules. Well, no one can help get you through that like your spouse. They can ask the questions for you, write down the answers, ask for clarification, make sure everything's straight, get your schedule. So from a medical and logistical standpoint, no one can help you like your spouse. Make sure that every question's answered, that you have 5 radiation treatments a week. They make sure you're there. No one looks over you medically and sees how you're responding at home to your treatment. If you're getting sick from your chemo and it's worrisome, your spouse is going to get you back to the doctor. Your spouse can help understand if you're having a complication or side effect. And then there's the whole emotional side, the emotional support system. And what's interesting in the study, Robin, is that all of the benefits I've described already that were found were greater for married men than for married women.
Right. And so this may be because a wife is more organized, used to taking care of the kids more. I mean, women and men are different in the way that they take care of their children. So probably women and men are different in the way they take care of each other.
Right. So there's the question, and you can go down a number of different pathways, and you can be a cynic and say, well, when a wife gets a cancer, the husband's just not as supportive. The study doesn't specifically show that, and as a cancer surgeon, I can tell you that has never been my experience. But what we see in cancer, and we see this in a lot of very serious diseases, is that the husband has as the greatest strength, and often the only strength and source of support, the spouse or immediate family. Whereas a wife greatly depends on her husband, but also has a stronger social network among female friends. So that if the wife gets cancer, she definitely benefits from being married, dramatic benefits versus an unmarried woman. But she also has these other tight, deep personal resources. The married husband does better than the unmarried man, and a larger part of that is likely due to his wife being his major and often only support network.
Okay, so break this down. It's just really more important for that married man. He really benefits even more than a married woman from being married while having cancer.
Well, you're saying that in either situation, the married husband or wife does far better in outcomes than their unmarried counterpart. It just appears that those benefits are greater for the married man versus the unmarried man than the married woman versus the unmarried woman. And that's probably because the wife has a broader support network. Her husband is certainly the strongest, but there are often others. Whereas for the husband, the wife is the strongest, and he probably has fewer close ties outside of his marriage.
So then can we say from all of this, an unmarried woman does better than an unmarried man with cancer?
So that's a different question that the study did not answer. So we can make some assumptions, and we may be wrong. You have to be very careful. But if you do believe that the reason that the married man has a greater benefit than even the married woman, and you believe it's because of support networks, it's probably a reasonable thing to suggest, though it should be verified, that may be true for the unmarried woman versus man as well. And people often ask, well, I'm unmarried, but I have a very close friend. There is no doubt for cancer patients and for anyone with significant disease that having strong ties to people who are truly invested emotionally in you will always help. What this study really did was help define the difference between a marriage and those other relationships. It is always better to have people who are there for you, who can help you, who can ask the doctor questions, who can help get you to your appointments, who make sure that you're doing well at home. The more, the better. But what's unique in this study is that it points out that the marriage stands alone in terms of how strong that relationship is in terms of your survival.
So it's all really about taking control, making sure that, you're getting the best doctor, keeping track of appointments, really being in control of your cancer.
Well, this is a philosophy that I've come to believe, and I've actually written about it in a book called Own Your Cancer. And the title says it all. It is very, very easy when a patient is told they have cancer and they and their family are overwhelmed, it's complex, their whole world is shaken, they think time is of the essence. It's very easy for a patient and their family to basically give themselves over to the medical system and say, take care of me. And likewise, on our end as clinicians, as physicians and hospitals and health systems, it is, in effect, faster and easier just to suck those patients into the system and send them through. But I truly believe, from my experience and having partnered with so many patients with cancers and their family, that this is really wrong. I think it is critical that cancer patients and their families remain in the driver's seat, that they own their cancer, that they're involved in the decisions. And what could be a more important decision than determining how you want to address what could be a life-threatening situation? The real key here is that patients often believe, and quite honestly, physicians and healthcare systems often allow them to believe, that they have to understand everything about cancer to be involved in the decisions, and that's just not true. I have always assumed, and I've never been proved wrong, that my patients may not speak the language of medicine, but they're bright and they're clearly invested in their own health and survival. And if we take time and teach patients about the limited number of critical parts of their cancer journey that they have to understand, not only will they understand them, but they become great partners in driving all the decisions that impact their care. And as a physician, it is much more rewarding and much more successful to partner with a cancer patient and their loved ones and make decisions about how they should go about seeking treatment and what happens down the road. So I believe that they should own their cancer. I think the burden is on clinicians and patients and families to say, we are in this together. Don't just give yourself over to the system and hope it works.
Right. Support is so important with your doctor and with your loved ones in helping you just keep track of everything that's going on when you have cancer.
That's exactly right. If you have friends, family, loved ones, you can use them. And when I talk about owning cancer, what you're touching on is right, Robin. That's the tactical piece. How do I make sure that things get scheduled? What questions do I ask? The other part of it, and the part that I preach and I write about, is the strategic part, which is many patients just accept, for example, point blank, that whomever their primary care physician refers them to for their cancer surgery is their cancer surgeon. And if we chose our babysitters that way, just whoever someone says should babysit my child, who knows what would happen? The same is true for cancer. So I try to teach the strategic as well. How do you determine if the surgeon's the right fit for you? How do you know if the oncologist is the right person for you? Do you need to go to a big-name institution, or is your hospital okay? What do I need to know about my cancer stage? So those things sound overwhelming, but they really aren't if they're taught in the right way, and that's what we try to do. Then you get down to the tactical, as you point out. How do you schedule? Who can help you? What resources do I need? But the truth is, cancer patients with their family or their friends can learn these critical things and can implement the tactical approaches that you've mentioned and succeed in really partnering and not losing control of the process. And when that happens, it is a much better outcome for the patients, because regardless of their success in treating their cancer, they keep their independence. They maintain their dignity and control over their life. And
so the bottom line really is, married or not, just as long as you as a patient take control, because doctors want that involvement. They want the questions. They want the help. They want the person to take control of their cancer, own it, as you say. And, all in all, everyone will be more of a success.
That's absolutely right. The difference between patients and families who feel in control and those who just give up control has always impressed me as their partner. And it's interesting to see that even when I've had patients who ultimately died of their cancer, if they've been part of the process, they've made the decisions, they've been encouraged to have discussions with their friends and families about what this all means, they have a very different level of quality of life during the remainder of their life. Whereas sometimes I've had patients who ultimately get cured but have really been passive the whole way, and the whole experience has been draining, and they have no quality of life during that process. So it's very important for people not to abandon everything that they've worked so hard for. We make complex decisions about ourselves and our families all the time. This is not the time to abandon that independence and that ability.
Dr. Peter Edelstein, thank you so much. Dr. Peter Edelstein is the author of the upcoming book, Own Your Cancer, a take-charge guide for the recently diagnosed and those who love them. Thanks for listening. You've been listening to Front Range Focus. I'm Robin Hart.